Hello, everyone. My name is Dr. Blake Mitchell. I'm here on behalf of Practice Evolution Partners to speak with you about dental practice sale preparation. A little bit about me. I received my Doctor of Dental Medicine from the University of Saskatchewan. While I was there, in addition to dentistry, I studied math, economics, and business. I practiced as an associate in Saskatoon, Gravelbourg, and Regina, Saskatchewan. Following my time as an associate, I established multiple clinics and practiced as the principal dentist and operating owner. Those practices were established in Saskatchewan as well as Alberta. In addition, I'm also the founder of Oral Health Brands, which is a multi-brand dental services company. We focus on technology, business development, and vertical integration within the dental industry. We provide startup, acquisition, operational, and exiting consulting, in addition to supplies, procurement and management, marketing and branding, administration services, financial services, as well as human resource management. In addition, I'm the co-founder of a multi-brand franchisor company, bookkeeping and accounting firm, financial lending organization, and commercial real estate investment company. I have exited multiple companies that operated in both Canada and the United States. So why discuss practice, sale, exit preparation? There are a few problems that exist when a dental practice owner is looking to sell. The main problem is that they need to increase their EBITDA. When selling their office and wanting to capture the most value for that office, EBITDA is the most important factor that we need to consider. At one time, practices were evaluated primarily through a metric of gross revenue. Evaluators would use a number of formulas, but us in the dental industry would discuss things relative to 1 year's gross revenue and a multiple of 1 year's gross revenue. With the introduction of private equity-backed companies, public companies, dental service organizations, and other groups, we've migrated over to the factor of EBITDA and are now valuing practices based off of that, similar to businesses in other industries. Another problem that practice sellers encounter, whether they realize it or not, is that they need to make their practice as attractive as possible to potential buyers. By making it more attractive, buyers will become emotionally invested and will pay a higher price for that office. Oftentimes, practice owners don't know what they need to modify to increase their EBITDA or make it more attractive. And even if they do know what to modify, they don't know how to implement those changes without significantly disrupting their day-to-day operation of their practice. So what's the solution? The solution is to get an outsider. When you bring in an outsider, they look at things different from the owner. The owner has preconceived conceptions and perceived notions. They're emotionally invested and tied to their office, and they're operating too deep in the weeds, and oftentimes have a hard time seeing the big picture and the strategy. An outsider can view the practice from an unemotional, objective standpoint, and they can view it from a holistic standpoint and identify a clear direction that practice needs to take to help increase its value and ultimately sale price. As mentioned, the goal is to increase the sale price, and the goal is to do that over 12 to 18 months. Long enough to show a track record to a potential buyer, but also short enough that the seller can get out of their practice in a reasonable amount of time. How do we do it? As we discussed, we increase the EBITDA, the earnings before interest, taxes, depreciation, and amortization, and we make the practice as attractive as possible to potential buyers. We do that through a number of mediums, but some of the most important ones are patient flow, looking at provider replaceability, the branding and marketing of the office, as well as many other aspects. Our process starts with an initial evaluation. We look at human resources, one of the most important aspects of a service business such as dentistry. We look at the labor cost. Where is that in line with industry standards? What is the production and cost comparison with human resources, and how productive on an operational basis are the people in that office? We want to know what contracts are in place, both from a human resources perspective, but also service and maintenance contracts and any other contracts that the office might have with internal or external individuals or companies. We look at the hygiene production. We want to know if it's underproducing or if there's unrealized revenue due to maybe underscheduling, a poor recall program, or several other factors. We look at the office overhead. Very important. Many people do look at that on an ongoing basis, but we want to know where the clinic expenses are at and if they're in line with the industry averages. And we want to identify opportunities to decrease that overhead and ultimately increase EBITDA. We look at supplies being one of the top 3 highest expenses in many offices. We want to know where that sits as a percent of revenue. Is the office overspending? Are they underspending? Are supplies costs so low that a potential buyer is going to look at that and say that this isn't real? It's not maintainable. We also want to look and see if supplies are being undermanaged. Are they being wasted? Are too many supplies in stock? Is there too much cash tied up in supplies? Are there opportunities to switch brands that are lower priced that are going to decrease costs and increase EBITDA, and yet not affect the day-to-day operations of the clinic or the quality of service that clinicians are providing? We want to look at the equipment. We want to know the quality and condition of that equipment. Are replacements needed? Buyers want to see that equipment has been well maintained and updated throughout its life cycle. It's important to look at new patient flow. Even though a seller may be on their way out and may not be as concerned with it, new buyers are. And they want to know if the new patient flow is stagnant and what those net new patient numbers are like. It's important to note that net new patient numbers are more important than new patient numbers. And we can get into that in further detail with a seller and defining exactly what net new patients mean and why it's more important than the generic new patient number metric that a lot of offices look at. We want to look at your administration department. We want to see if they're being proactive or if they're operating in a reactive state. Are there opportunities to increase revenue, make the practice more productive, and get administration in a proactive state? We often look at the dentist production. Buyers are wanting to know, is that dentist production replicable, or is there a significant downside risk with a new owner and buyer when that seller potentially leaves their office? The KPIs, key performance indicators, we want to know if an office is tracking any. If they are, we look at them. We may need to add in new ones and calculate new KPIs. KPIs allow us to identify weaknesses and opportunities in the office and provide recommendations in areas to improve and increase the value. We look at branding and marketing. We want to know what the clinic's brand presence is like, both online and in person. We check to see if the brand is up to date or if it's stagnant and needs a refresh. We want to know if the practice is spending any money on marketing it. Is it active? If they are active with marketing, is that marketing effective? Is it bringing in new patients? We want to look at the lease. Buyers want to see, when does the lease expire? Are there renewal options? What are the market rates like? What are there demolition clauses in the lease? What do the details of that lease look like? And where do the lease rates fall relative to market averages? And we look at operations as a whole. Are there systems in place? Do we need to put systems in place? Is the clinic operating efficiently, or does it need new systems and procedures to become more efficient? It's important to consider what considerations a buyer is looking at. We see the 6 most important things that a buyer is considering being patient flow and growth potential. They want to buy a clinic that is going to grow. They want to know if they're putting their money into an asset that is going to increase in value over time for them. A big part of that is the financial statements. They want to see where things are at, how the clinic's operating. Are there opportunities to increase revenue or decrease expenses? They want to see what long-term staff is in place. What is the risk of that staff leaving? Are they crucial to the operation of the office? What's it gonna look like post-sale for that long-term staff? In terms of real estate, they want to know if they're renting or if they are being encouraged to purchase the building that the office is operating out of. Some buyers are interested in owning real estate, others are not. It's important for a seller to identify who their ideal buyer is and how that will look from a real estate leasing or owning perspective, and how that may affect their sales structure. Replicability is big in several areas of the practice, from primary provider production to operations to key personnel. Buyers are wanting to know what the day-to-day operations of a practice are going to look like after they purchase it. And if the current nature of the practice is replicable, or if there's significant downside risk. And they also look at the equipment and leaseholds. They want to see if things are in good condition, or if they're coming into a significant expense in having to update equipment and leaseholds. Although probably one of the easier things to do is do a leasehold refresh and update equipment, it often deters a lot of buyers, and the potential expense in their mind is often much greater. As mentioned before, we want to increase the value. We want to increase the value of the practice by either lowering the expenses or increasing the revenue, which ultimately increases the EBITDA. We increase the EBITDA, we increase the valuation. A lot of offices may have opportunities to increase EBITDA, but may not be interested while they're operating their office. The changes that they would have to make may not reflect the lifestyle nature of their practice and may not be in line with that. However, when preparing for a sale, they may consider making changes to reflect an increase in EBITDA and capture capture higher valuation on an office, on their clinic when they sell it. You can see below in this example that a $75,000 increase in EBITDA at 8 times multiple, which is very in line with current multiples we're seeing offices sell at, single offices of moderate size, at 8 times. That increase of $75,000 in EBITDA results in an increased valuation of $600,000. So an office owner potentially selling their office may say, well, these changes I have to make are only going to increase my bottom line by $75,000. It's not worth it. But the real value is the increase that they see from the sale price of that one-time transaction. Our process is pretty straightforward. We believe in gathering data initially. Our thought process is that we can't make informed, intelligent suggestions without proper data and practice and assessing the practice. The data we look for are financials, patient numbers, staffing information, various key performance indicators, and a wide variety of other information that may be applicable for an individual office. Once we have that data, we look at the we do a practice performance assessment where we analyze that data and we develop a deeper understanding of how the clinic is actually performing. From that practice assessment, we provide recommendations. We recommend actions based on that practice performance assessment. Once the seller and us agree on recommendations that should be implemented, we do that. We implement the recommendations, and we provide guided steps and also additional and support services to implement those suggested changes to the clinic. And then on an ongoing basis, we monitor those changes, and we do that through monthly reviews, and then we make adjustments and monitor our action plan as needed. Practices looking to sell and increase their EBITDA may view any changes as a daunting task because it may require bringing in outside people or service providers that may not be available in the clinic at the time to implement strategies. They may not even be available within the communities that an office is currently located in. Through our company, Oral Health Brands, we provide these services on an ongoing basis, operational support services to dental practices on an ongoing basis across Canada. So they've been designed and set up to be available and offered from a distance from the beginning. That's how they're initially structured. So an office looking to sell very well could, if they need to make some changes, but didn't have access to the people to make those changes for them, bring on our people who specialize in a number of areas, as you can see on the screen here, in administration, bookkeeping, supplies, human resources, and marketing, to help implement best practices and modifications in the practice. Through our administration team, we can help with phone answering, email responding, communication, scheduling of patients, insurance pre-authorization, submissions, follow-ups, as well as recalls. Our bookkeeping team provides profit and loss statements, cash flow statements on a monthly basis, as well as calculation of key performance indicators and monitoring of those key performance indicators, as well as analysis of them, discussions, and strategy to help improve those key performance indicators. In addition, they also do payroll, setup, and management. We have a team that focuses on supplies. They provide services around the import and distribution of supplies, as well as the purchasing of supplies from existing distributors. We also work with a lot of clinics to get their supplies area set up and automated to help reduce the expense associated with managing supplies, and also make the supplies management process as foolproof as possible, and reducing any errors in supplies reordering and purchasing. Our human resources team focuses on, one, bringing in staff through talent acquisition strategies. They also provide employee relations on services on an ongoing basis. A lot of that ties into staff retention, making sure staff is satisfied and their needs are being addressed on an ongoing basis. We deal with employee contracts, and at the end of the employee's life cycle with the business, we also provide termination services for with respect to human resources. Our marketing team helps practices develop, maintain, monitor their branding and advertising strategies, whether that be digital or traditional mediums. They deal with social media, search engine optimization, SEO, as well as search engine marketing, SEM, and several other areas of marketing through content creation and distribution. As many people would know, marketing in dentistry can be challenging, especially with advertising regulations. And it's comforting to know that our marketing team focuses solely on the dental industry. So they're very well versed in the advertising regulations in Canada. So in summary, an increase in EBITDA will increase the one-time sale price of a practice. As outsiders, we can clearly identify opportunities and implement strategies on behalf of practice owners and sellers. And we have service providers that specialize in individual practice areas in place that are ready to serve owners across the country. Thank you for your time. And if you have any questions or would like to dive deeper into preparing your practice for sale, please contact the Practice Evolution Partners team at admin@practiceevolutionpartners.com. Once again, I'm Dr. Blake Mitchell, and thank you for your time.